I need to tell you something that could save your life or the life of someone you love. Right now, millions of seniors are taking their diabetes medications the wrong way. And it's not their fault. The problem is, nobody's explaining the dangers that come with aging and diabetes medications together. Here's what's happening. As we get older, our bodies process medications differently. That diabetes pill that worked perfectly when you were 50 might be too strong now that you're 70. And the consequences? They can be devastating. Low blood sugar episodes that lead to falls, confusion, even hospitalization. So why isn't anyone talking about this? Because the conversation around diabetes management hasn't caught up with the reality of aging. Today, we're going to change that. I'm going to walk you through everything you need to know about managing diabetes medications safely in your golden years. Let's start with the most important thing you need to understand. Your kidneys and liver don't work the same way they did 20 years ago. These organs are responsible for processing and eliminating medications from your body. When they slow down, medications stay in your system longer. This means that standard doses can become dangerously high doses for seniors. Think about it this way. Imagine a sink with a slow drain. If you keep the water running at full blast, eventually it's going to overflow. That's exactly what happens in your body when medications aren't adjusted for age. The medication builds up, and suddenly you're experiencing side effects that nobody warned you about. Now, let's talk about the specific risks seniors face with diabetes medications. The biggest danger is hypoglycemia, which is when your blood sugar drops too low. For younger people, this might cause shakiness or sweating. But for seniors, the symptoms can be much more serious and much less obvious. Here's where it gets really concerning. Older adults often don't feel the warning signs of low blood sugar. You might not get the typical shakiness or hunger pangs. Instead, you might just feel confused or tired. And here's the scary part. These symptoms look a lot like dementia or just normal aging. So people ignore them. But low blood sugar in seniors can lead to falls. And falls in older adults can be catastrophic. We're talking broken hips, head injuries, loss of independence. All because a medication dose wasn't properly adjusted for age. This is why getting your diabetes medication management right is absolutely critical. Let me give you a real example. Sulfonylureas are a common class of diabetes medications. They work by making your pancreas produce more insulin. Sounds good, right? But in seniors, these medications can cause blood sugar to drop too low, especially if you skip a meal or exercise more than usual. Many doctors are now avoiding these medications in older patients for this exact reason. So what should you be taking instead? Newer medications like metformin are often safer for seniors because they don't cause low blood sugar as often. But here's the catch. Even metformin needs to be adjusted based on your kidney function. If your kidneys aren't working well, metformin can build up and cause serious problems. This brings us to a crucial point. You need regular kidney function tests. I'm talking about at least once a year, maybe more often if you have kidney disease. These simple blood tests can tell your doctor if your medication doses need to be adjusted. Don't skip these tests. They're not optional. Now let's discuss insulin, because this is where things get really complicated for seniors. If you're taking insulin, you need to be extra careful. Insulin is powerful, and it can cause severe low blood sugar if the dose is too high. But here's the problem. Many seniors have trouble with the physical act of injecting insulin. Arthritis can make it hard to handle syringes or insulin pens. Vision problems can make it difficult to read the dose markings. Memory issues can lead to forgetting whether you've already taken your dose. All of these factors increase the risk of taking too much or too little insulin. And both scenarios are dangerous. So what's the solution? First, Talk to your doctor about insulin pens with larger, easier to read numbers. Some pens even have memory functions that tell you when you last took a dose. Second, consider setting up a medication management system. This could be as simple as a pill organizer or as sophisticated as an automated dispenser. Here's another critical factor that nobody talks about enough. Drug interactions. Seniors typically take multiple medications for various conditions. Heart disease, high blood pressure, cholesterol, arthritis. The list goes on, and here's the problem. Some of these medications can interact with your diabetes drugs in dangerous ways. For example, certain blood pressure medications can mask the symptoms of low blood sugar. Steroids, which are often prescribed for arthritis or lung conditions, can raise your blood sugar. Even over-the-counter medications like aspirin can affect how your diabetes medications work. This is why you need a comprehensive medication review at least once a year. Bring all your medications to your doctor's appointment. And I mean all of them. Prescription drugs, over-the-counter medications, vitamins, supplements, herbal remedies. Everything. Your doctor needs to see the complete picture to make sure nothing is interacting badly with your diabetes medications. Let's talk about something that often gets overlooked. Eating patterns change as we age. Maybe you're not as hungry as you used to be. Maybe you're eating smaller meals more frequently. Or maybe you're skipping meals altogether because you live alone and don't feel like cooking. All of these changes affect how your diabetes medications work. If you're taking medications that lower blood sugar, you need to eat regularly. Skipping meals while on these medications is a recipe for dangerous low blood sugar. But forcing yourself to eat when you're not hungry isn't the answer either. The solution is working with your doctor to adjust your medication schedule to match your actual eating patterns. Here's a practical tip that can make a huge difference. Keep a food and medication diary for a week. Write down what you eat, when you eat it, when you take your medications, and how you feel throughout the day. This information is gold for your doctor. It helps them see patterns and adjust your treatment plan accordingly. Now, let's address blood sugar monitoring. If you have diabetes, you need to check your blood sugar regularly. But for seniors, the target numbers are often different than for younger adults. Your doctor might actually want your blood sugar to run a bit higher to reduce the risk of dangerous lows. This might sound counterintuitive. We're always told to keep blood sugar as close to normal as possible. But for older adults, especially those living alone or with other health conditions, slightly higher blood sugar is safer than risking severe hypoglycemia. Talk to your doctor about what your personal target range should be. Technology can be a game changer here. Continuous glucose monitors are devices that check your blood sugar automatically throughout the day and night. They can alert you if your blood sugar is getting too low or too high. For seniors who have trouble feeling low blood sugar symptoms, these devices can literally be life-saving. Here's something else to consider. Your diabetes management plan should evolve as you age. What worked when you were 60 might not be appropriate when you're 80. Your goals should shift from preventing long-term complications to maintaining quality of life and avoiding dangerous medication side effects. This means having honest conversations with your doctor. If tight blood sugar control is causing frequent lows, it's okay to loosen the targets. If multiple daily insulin injections are becoming too difficult to manage, it's okay to explore simpler regimens. The goal is safe, sustainable diabetes management that fits your life. Let's talk about warning signs that your medications might need adjustment. If you're experiencing frequent episodes of dizziness, confusion, shakiness, or extreme fatigue, tell your doctor immediately. These could be signs of low blood sugar. On the flip side, if you're constantly thirsty, urinating frequently, or losing weight without trying, your blood sugar might be running too high. Don't wait for your scheduled appointment if you're having these symptoms. Call your doctor right away. Medication adjustments might be needed urgently. And if you experience severe symptoms like loss of consciousness, seizures, or inability to wake up, this is a medical emergency. Call 911 immediately. Here's a crucial point about medication timing. Some diabetes medications work best when taken with food. Others need to be taken on an empty stomach. Getting the timing wrong can affect how well the medication works and increase the risk of side effects. Make sure you understand exactly when and how to take each of your medications. Create a medication schedule that's easy to follow. Use alarms on your phone or watch to remind you when it's time to take your pills. Keep your medications in a place where you'll see them at the right time. If you take morning medications with breakfast, keep them near your coffee maker. Simple systems like this can prevent missed doses and dangerous mistakes. Now let's address the elephant in the room. Cost. Diabetes medications can be expensive, especially for seniors on fixed incomes. But here's what you need to know. Never, ever skip doses or cut pills in half to make them last longer unless your doctor specifically tells you to. This is incredibly dangerous and can lead to serious complications. If you're struggling to afford your medications, talk to your doctor. There are often less expensive alternatives that work just as well. Patient assistance programs can help cover costs. Generic versions of many diabetes medications are available at much lower prices. Your pharmacist can also be a great resource for finding cost-saving options. Here's something many seniors don't realize. Your local area agency on aging can help you navigate medication assistance programs. They can connect you with resources you didn't even know existed. Don't let pride or embarrassment stop you from asking for help. Your health is too important. Let's talk about the role of caregivers in diabetes medication management. If you have a spouse, adult child, or other caregiver helping you, make sure they understand your medications too. They should know what you take, when you take it, and what side effects to watch for. In an emergency, this information could save your life. Consider creating a medication information card to keep in your wallet. List all your medications, doses, and times you take them. Include your doctor's contact information and any drug allergies. If you end up in the emergency room, this card ensures medical staff have the information they need to treat you safely. Here's a final critical point. Regular follow-up with your doctor is non-negotiable. At minimum, you should see your doctor every 3 to 6 months for diabetes management. More often if your medications are being adjusted or if you're having problems. These visits are your opportunity to discuss concerns, review your blood sugar logs, and make sure your treatment plan is still working for you. During these visits, ask questions. Lots of questions. Why am I taking this medication? What are the side effects I should watch for? Are there alternatives? What should I do if I miss a dose? How does this interact with my other medications? Your doctor should be willing to answer all of these questions thoroughly. Remember, managing diabetes medications safely in your golden years isn't about perfection. It's about finding a balance between controlling your blood sugar and maintaining your quality of life. It's about preventing dangerous complications while avoiding medication side effects. And it's about staying independent and healthy for as long as possible. The key takeaway here is this. Your diabetes medication plan should be personalized for your age, your other health conditions, your lifestyle, and your goals. What works for someone else might not work for you. And what worked for you 10 years ago might need to be adjusted now. Stay engaged with your healthcare team, speak up about concerns, and never hesitate to ask for help. Your golden years should be just that. Golden. With the right medication management, you can keep your diabetes under control while enjoying life to the fullest. Stay safe, stay informed, and take control of your health.